Okay, now I'm going to show you how to take an anesthetized mouse, put it in a stereotactic frame, and implanting some tumor cells. First thing to do is make sure you get the mouse in the proper position. So using this contraption that goes into its teeth, I'm going to want to line it up here. I'll put the tip of the mouse's nose right on top just initially. And right here, base of the ears, you can actually put these grips, slide them into place gently. You don't want to shove them in there because you could hurt the mouse. And then tighten them. Tighten both of them. Now what I want to do is, and this takes a little bit of a practice, using one of my Q-tips, I'm actually going to go in and open its mouth. With the nose there, I'm actually going to get the mouse's teeth right into the groove. Once he's there, I can actually tighten this contraption, squeeze this guy to make sure it's nice and tight. Not too tight, it does have a spring to prevent from too much pressure. Okay, now I'll just tap on the skull just to make sure it's not moving around, and if it's stable like that, then we're ready to go. I'll actually pull out the mouse's leg just so it's a little bit more comfortable for the animal, less stress. Cover it with a sterile gauze pad, and it's good. Now, you want to wipe down the area with ethanol, so make sure it's nice and clean. I've already put some betadine solution into a cup. I use this Q-tip to rub it and make sure I sterilize it even more. Betadine can actually burn the skin, so you also want to make sure you take the original alcohol swab, wipe it down again. This animal is ready to go. Before we begin doing anything else, I'll put some ointment on its eyes because it won't be able to shut its eyes under this anesthesia. Stab a little bit on top of each eyeball. Okay, and I'm going to take a sterile scalpel. Put my finger right here. You want to just do a nice line right at the midline. Okay, nice and gently. Try to do it in one scoop. Then on that same line, you can actually go. It's already opened up. You can cut a little bit further. With the scalpel, actually make sure that you move away, kind of scrape off the bregma that's underneath, on top of the skull. If you don't, when you're using a drill bit, you will see that it'll actually wrap around the drill bit. Okay, I've got that nice and clean. I'll take another sterile Q-tip. Make sure you wipe it down, and you can actually clean it off a little bit more. When you dry it out like that, the skin should stay open. Take my drill bit, put it at the lowest gauge, make sure you balance it, and I'm going a little bit off to the right of the initial midline, and that's it. As soon as you see it, as soon as you see a release, you want to make sure you pull out. Okay, now this guy is ready to be injected. Good. What you want to do is you want to actually, I'm doing this by hand. There are contraptions that you can actually use. On the syringe, you see there's a little black line. That's the gauge of how far I need to go down. What you want to do is make sure you get this right into the hole you've already cut, down, and then pull up just a small bit, just to give enough space. I'm going to inject 2 microliters worth of my cells into this, into the brain. Slowly, ever so slowly, you want to pull out. If you pull out too fast, the vacuum pull will actually pull your cells out. This guy's out, and lay my syringe down. Now I'm going to take bone wax, sterile bone wax, just a little bit, and then actually you're just going to put it into the hole, and it's going to seal off and cover that spot. Okay? Now all I need to do, grab a staple, grab forceps. I tend to grab the very back of the cut, squeeze that, we're clipped. It's done. Last step in this, and the last and final step, I've already put the staple on. What I want to do is dip this into the betadine solution, kind of dab it all throughout around the staple, making sure that it sterilizes around and on the cut, and wipe off any excess with an alcohol swab, and this animal is done. You want to slowly open up the grips on the side. You want to open it up here. I'll unscrew this back area, kind of tilt it with my finger, get his teeth off of the hole, and pull that out. This guy's free. You want to set him in a sterile cage, put him on a heat pad, and make sure you monitor this animal every 15 minutes just to make sure it's breathing, the heart rate is still up, and inject it with a little bit of painkiller, and then keep my eye on this animal throughout the duration of your experiment. Alright, thank you.